Cold sores, also known as fever blisters, are small, fluid-filled blisters that typically appear on or around the lips. These pesky little sores are simply the visible symptom of an infection by the herpes simplex virus. There are two types of herpes simplex virus: HSV-1 and HSV-2. While both can cause cold sores, HSV-1 is the more common cause for oral infections, while HSV-2 is typically associated with genital herpes. However, it's important to note that either type can infect either location. When the herpes virus enters the body, it travels through the nerves to the surface of the skin, where it causes the characteristic blisters. What makes this virus particularly tricky is that once you're infected, it never truly leaves your body. Instead, it lies dormant in nerve cells, waiting for an opportunity to reactivate and cause another outbreak. Cold sores are incredibly common. In fact, it's estimated that about 67% of the global population under the age of 50 is infected with HSV-1. In the United States alone, about 50 to 80% of adults have been infected with the virus. However, not everyone who carries the virus will experience outbreaks of cold sores. Some people may be infected but never show symptoms, while others may have frequent outbreaks. Causes of cold sores. The causes of cold sores revolve around the herpes simplex virus. The first time you're infected with HSV-1, you might not even notice symptoms, or you may have a severe outbreak, depending on your body's response. This initial infection is called primary herpes and tends to happen in childhood for most of us. After this first exposure, the virus hides in the nerve cells near the site of infection and lies dormant. It can stay dormant for years without causing any issues, but certain triggers can wake it up, leading to a cold sore outbreak. Stress is a major trigger for many people. When we're stressed, our immune system can be weakened, giving the dormant virus an opportunity to reactivate. This is why you might notice cold sores popping up during particularly stressful periods in your life, like during exams or a big work project. Illness or a weakened immune system can also trigger outbreaks. When your body is fighting off another infection, like a cold or flu, it might not be able to keep the herpes virus in check as effectively. This is why cold sores are sometimes called fever blisters. They often appear when you have a fever or are otherwise sick. Hormonal changes can be another trigger, especially for women. Some women notice outbreaks around their menstrual period or during pregnancy. The exact reason for this isn't fully understood, but it's thought to be related to fluctuations in hormone levels. Interestingly, certain foods or dietary deficiencies might also play a role. Some people report outbreaks after eating particular foods, especially those high in the amino acid arginine, like nuts and chocolate. On the flip side, not getting enough of certain nutrients, particularly lysine, might make you more susceptible to outbreaks. Even though HSV-1 is the main cause of cold sores, HSV-2 can cause them too, though it's far less common. If HSV-2 is spread to the mouth, usually through oral contact, it can also cause cold sores. Symptoms of cold sores. The symptoms of cold sores typically follow a predictable pattern, which can be broken down into several stages. The first sign that a cold sore is developing is often a tingling, itching, or burning sensation in the area where the blister will appear. This is called the prodrome stage, and it usually occurs a day or two before the sore becomes visible. Next comes the blister stage. Small, fluid-filled blisters appear, usually clustered together. These blisters are typically found on or around the lips, but they can also occur on the nose, chin, or cheeks. The area around the blisters is often red and swollen. After a day or two, the blisters will burst and ooze fluid. This is called the ulcer stage, and it's often the most painful part of the cold sore cycle. The sores are open at this point and may look like small, red, shallow ulcers. As the sores begin to heal, they'll start to dry out and crust over. This scabbing stage can be itchy and uncomfortable, but it's a sign that healing is underway. Finally, the scab will fall off and the cold sore will heal completely. The whole process usually takes about 7 to 10 days, although it can sometimes last up to 2 weeks. Beyond the physical discomfort, cold sores can also cause emotional distress. Because they're visible and sometimes associated with stigma, people with cold sores often feel self-conscious or embarrassed. This can lead to social withdrawal during outbreaks. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of cold sores. Diagnosing cold sores is typically straightforward and can often be done based on appearance alone. Most doctors can recognize a cold sore just by looking at it. However, if there's any doubt or if the sores are recurring frequently, a doctor might perform additional tests. One common test is a viral culture. This involves taking a sample from the sore and testing it in a laboratory to confirm the presence of the herpes simplex virus. Another option is a blood test, which can detect antibodies to the herpes virus. This can be particularly useful if you're not currently having an outbreak, but want to know if you've been infected with the virus. In some cases, especially if the sores are atypical or not responding to treatment, a doctor might perform a biopsy. This involves taking a small sample of tissue from the sore and examining it under a microscope. Treatment for cold sores. Unfortunately, there is no cure for the herpes simplex virus, so once you have it, it's with you for life. However, there are several treatments that can help reduce the severity and duration of outbreaks. Over-the-counter antiviral creams containing docosahexaenol or benzyl alcohol can be effective if applied early in the outbreak, ideally during the prodrome stage. These creams work by preventing the virus from entering healthy cells, which limits its spread. For more frequent or severe outbreaks, oral antiviral medications might be prescribed. Drugs like acyclovir, valacyclovir, and famciclovir can help shorten the duration of an outbreak and may also be used as a preventive measure for people who experience frequent recurrences. Pain relief is another important aspect of cold sore treatment. Over-the-counter pain relievers like acetaminophen or ibuprofen can help manage the pain and discomfort. Topical anesthetics containing benzocaine or lidocaine can provide temporary numbing relief. Home remedies for cold sores. In addition to the medications mentioned, some home remedies can help soothe the discomfort of a cold sore. For example, applying a cold compress to the affected area can help reduce swelling and provide some pain relief. Some people find that dabbing a bit of petroleum jelly on the sore helps prevent cracking and eases discomfort. Some people also find relief using lip balms that contain sunscreen, which can prevent further irritation from sun exposure. Lysine supplements are popular among some cold sore sufferers. While the scientific evidence is mixed, some studies suggest that lysine might help prevent outbreaks or reduce their severity. As always, it's best to consult with a healthcare provider before starting any new supplement regimen. Other than that, keeping the affected area clean and avoiding touching or picking at the sore can prevent infection and help it heal faster. It's also a good idea to stay hydrated, eat soft foods that don't irritate the mouth, and avoid salty or spicy foods during an outbreak. It's important to note that while a cold sore is active, it's highly contagious. Even after the blister has crusted over, the virus can still be spread until the sore has fully healed. So, to avoid spreading the virus, it's important to avoid kissing or sharing utensils. Washing your hands frequently, especially after touching the sore, is also essential. This is because it's possible to spread the virus to other parts of your body, such as your eyes, if you touch a cold sore and then touch another area. This is called autoinoculation and can lead to more serious infections, like ocular herpes, which affects the eyes and can cause vision problems. Now, we want to hear from you. Have you ever experienced a cold sore outbreak? What triggers have you noticed, and how do you usually manage them? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.